Morning, Andrew. Thank you very much for talking to me today, for being with us.
You're welcome. I'm very happy to be here.
So I just wanted you to talk about your experience in Crooke Dental practice, no, Crooke Dental Clinics. First of all, I would like to know what was your main worry about your teeth before getting in touch with us? Did you feel confident when smiling, or what happened?
Well, I think I had two worries to start with. Actually, the one that I thought was the most important at the time when I started thinking about having something done to my teeth, it was that I was having pain in my jaw and in my neck, going all the way down my shoulder and in my back and everything. And that was because my bite wasn't in the right place. There was only a few teeth coming together. So when I was eating, my jaw was moving all over the place. So that was the stress, and that's the original idea for going to see a dentist. But the smile was really a secondary issue, and I find that really quite interesting now that I didn't think it was that important before. I didn't think it was a big thing. In fact, I was really adamant that I wasn't going to do this for aesthetic reasons, even though my face is this image is quite important. Really, it's important to what I do and how I interact with people. And I have a YouTube channel, as you know. I'm a singer and an entertainer and an actor, but still, I don't think I realised until during the process what a difference it would make to my work, and more importantly to my self-confidence. So along the way, that became the big issue.
Okay. And how did you get to know Crooke Dental Clinics? What made you choose us?
Well, I started off on a Google search to begin with, and I looked at loads of reviews of different places, and I'm the sort of person that I research for days and days and days. And when it comes to finding a hotel to go on holiday or buying a car or anything, so my wife gets quite annoyed with me. I just get my head down for a couple of days, and I spend ages. So I'm used to sort of reading between the lines. When you get good reviews and bad reviews, sometimes you think, well, maybe the good reviews have been written by the company, and the bad reviews have just been written because of one silly thing that went on or miscommunication. So I'm used to judging what's a real complaint and what's a real positive review. So I was looking for a dentist that I could trust, really, because I've not really had good experiences in the past, which is one of the reasons my teeth was in such a mess to start with. Really.
That is what happens to many people. That they don't trust the dentist because of their experiences in the past. What would you say it would be a factor to make you think you can trust us? I mean, not now, because obviously you've undergone a treatment with us, and we believe you're happy with us. But what was that thing that made you think, look, these people are different?
It all happened through the first contact, and I could tell that there was a lot of detail being gone into, and there was an honesty about the whole process. It just sounded like the right place. The communication was really good, and I like good communication. I mean, it's part of my job. So that's what made me organise the consultation, to see if I was right, and that proved that I was.
Okay. Um, what can you tell us about your treatment? How long did it last? How was the surgery? Because it involved surgery.
Yes, it did. I mean, I found out that I needed a lot of work done. I think I knew that that's what was going to happen. Um, I mean, first of all, there was that first consultation, and Virginia, my contact, made me feel really, really welcome, and explained everything really well, gave me the confidence I was doing the right thing, that it would work out, and that's when we started talking about my new smile. That's when I started thinking about it a bit more, and looking at the pictures of me beforehand and realizing that I was hiding my smile. And when I opened my mouth, I was smiling like this. instead of showing my teeth.
Yeah.
And on my, if you look at my YouTube thumbnails before and after, you can't really see my teeth on the earlier ones, because when I posed, I'd pull, when I opened my mouth, I'd go, an expression like that.
Yeah.
I'd hide the teeth behind the gums. So, but after that first visit, and obviously it came to the main consultation, and I got to meet Felix, and also I was drawn in by all of this high tech equipment because I'm a bit of a techie.
Oh yeah.
Um, and Felix was really good because he, um, you know how you see the adverts on the internet about how you can get with loads of other companies that say get the treatment in 24 hours and have a full new set of lovely shiny implants, and they
Yeah.
show you 4 or 6 implants and then a full set of teeth on that. That's kind of what I thought was going to happen, and Felix explained very patiently that it's best to keep as many of your original teeth as possible and work with what you've got, and that most of all he was honest about the process of what the actual main operation was going to be and how to get the best results. And he's such a perfectionist, which I really like, because I am as well. And I really appreciate the detail he went into, and I love the 3D imaging, so that he knew more or less what he was going to do when he got me in the chair. He had a plan A, but he also had a plan B, because there's always something that you don't know. Once you extract a tooth, for example, you don't know exactly what might be underneath there. There's some things that you just can't check even with 3D imaging.
So you felt
Um,
like everything was under control. Like there was a
yeah,
plan A, plan B, just in case, and
mhm,
with the technology, everything was very,
mhm.
yes,
And
yes, under.
even if there needed to be a plan C, I felt confident that he could change the plan and come up with the right way to do it. So yeah.
So I want to focus on the technology because obviously there are not many people who know that there are some practices who that don't have a 3D scan, or
Yeah.
the kind of technology we have. Did you know this? Did you know that there's a huge difference between some practices and the others?
I learned that over the first consultation, and the first time I saw Felix. Really, yeah. When I saw it all happening, I mean, you can talk to somebody about it, but until you see it all in action, you might not get how good it is, and how you can turn the image around on the screen. And it's an interesting thing, because you'd think it would be a whole X-ray. Well, you do have an X-ray with that machine that goes around you,
Yeah.
but you also have this little, it looks like a pen, and it goes click, 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 and it draws the picture on the screen next to you. And that's amazing. And it tells you when it's finished, if there's a
Like
bit
you're in a
missing.
movie.
Yeah, yeah. Oh, it's brilliant. And I've got the films. I was, they were happy to give me the films of
So
this, so I can see it happening.
for sure, you knew what was gonna happen
Hmm.
before you started the treatment, right?
Hmm.
You could agree, yes, this is what I want. This is
Hmm.
you knew from the beginning the process.
Yeah, absolutely. And I knew there were going to be some complicated things, like I had to have a sinus lift,
Hmm.
because I think, can't remember which side it was. I think it's this one, and I knew that there wasn't quite enough bone there,
Hmm.
so they had to do a sinus lift so that the implant could go in. Yeah, it's this side because that's where the implant is, um, and also I needed to have a bone graft here
Wow.
because there just wasn't enough. So I knew that the treatment was going to be longer than what some people might have to experience, because it takes time for the bone graft to heal and the gums
Yeah.
to be ready. So,
You're a master now in dentistry.
yeah, yeah, yeah. I wouldn't like to do the operation myself. I don't think anybody would want me to either. But yeah, I mean,
And
I knew that the process was going to take, on the main day of the treatment, that was going to take about 3 hours.
okay. And how
And
was your recovery after that, after surgery and the whole process? How was your recovery?
well, the recovery's been pretty good. Do you want to hear about the actual the treatment? Because that was that was really interesting. I had, I mean, I had a sort of cleaning and preparation day first, and then it was like 3 weeks later for the main treatment, and it lasted, as far as I can remember, it lasted about 3 hours. But I can't remember the surgery because I'd asked for an anaesthetist to be there, and I couldn't be totally unconscious. I was
Yeah.
conscious for the whole thing, and because I needed to follow some instructions like where to move my head, open my mouth, etc.
Yeah.
But one of the sort of the cocktail of drugs that I was given
Yeah.
was removes your memory of the treatment. That's a common thing that you get in an anaesthetic. So I remember getting the drip in my arm to administer the chemicals and having a quick chat with the anaesthetist. And I remember Felix coming in, and then I just a blank. And then I remember Felix. I remember sort of coming round, and Felix was finishing off and cleaning up and putting in the
Like a dream.
temporary teeth.
Everything was like a
Yeah,
dream. Like,
well,
yeah.
it wasn't. Yeah, it was like a dream. That bit was like a dream, but the complete blank wasn't like a dream because there was nothing there. It's literally a blank in my memory, which
Okay.
is a weird. It was a weird feeling. And also, I'd arranged with Virginia to be there, and because my wife wanted a phone call to say he's okay and can we speak to him. So I spoke to her, that was quite a funny phone call because I was still like this, still felt completely off my face. And then I had a chauffeur actually on the day as well, all part of the service, which was brilliant because my wife was working on the day that the anaesthetist was available, so she couldn't pick me up. So Virginia said, "That's okay. We'll provide a driver." So that was the main day, and I've had a few processes after that to.
And the aftercare was fine. The practice got in
Mhm,
touch with you, gave you
mhm,
instructions for the following days. So
mhm.
everything
So
went
yeah,
well.
and the recovery, I would say, it took a few days because I mean there's going to be some kind of pain and discomfort after you've had such a lot done, especially with drilling through to get to the sinus and removing teeth and the bone grafts, which you know
But
it's surgery
you've
after
been a
all. So
great patient as well because you've been
mm,
following all the instructions and you've been taking care of your mouth and your teeth. So
yeah,
we always say that in order to have a treatment, a successful treatment, there
mhm,
must be a coordination between the dentist and the patient
mm,
because both of them have to make an effort.
yeah.
And you've been a great patient. So
Thank you.
thank you.
Well,
And
I've got a good smile out of it. So
in your
yeah,
opinion,
I mean, my gums still need to grow around some of the new teeth, but I was there last week actually, just doing some final adjustment because one of the teeth was still slightly long. I mean, we're talking fraction of a millimeter,
well,
and
but
so
you feel it. So if you feel it
yeah,
and
absolutely.
you want to change it, I mean, we
And
will work on that.
yeah, absolutely. And Felix was really good at finding exactly what to do and adjusting that. Actually, it wasn't Felix did the last bit. It was another one of the wonderful people in the clinic. So,
Thank you very
but it
much.
was just a an easy process. They put that it's a little piece of paper that they put in your mouth just to check, and you bite down on it to see exactly where the contact is.
Yeah.
And Felix had already said they might have to be just these tiny adjustments, and the pain of there was discomfort there because I was trying to bite things on this side and it wasn't quite hitting the right place. So, but after they just shaved off that little bit, just that one tooth, it's great. I can bite things on this side now,
And
and
you can
yeah,
eat, you can smile, you can laugh
hmm
with
yeah,
confidence. So I guess
absolutely.
you
Yeah.
would recommend us to other people, right?
I would, yes, yeah. I mean, there's only one thing that I'm ashamed of on the day was to do with the driver of the chauffeur of the car that brought me here because he was really lovely. He could speak enough English to communicate with me, so I fell into the usual the usual thing that English people do, which is going, oh, he speaks English, so I'll just speak in English. And we were talking about the World Cup because it was December at
Yeah.
the time when I had the main treatment. And we had a really good chat, and he was lovely. But I remember being ashamed as I got out of the car and thinking, I've got to speak on the way back. I've got to speak Spanish to him.
Well,
But when I got back to the car, I was so woozy that I just spent the time looking out of the window and I just didn't say a word. I'm sure he understood. I think he's probably used to
yeah, I
carrying people
mean,
back who, yeah.
we speak English, so everything is easier for you. I
Mm,
mean, we know that undergoing dental treatment or medical treatment, I mean, I want to speak my language. Even though,
mm,
for example, I speak English, I would prefer
mm,
to speak in Spanish with my doctor. So that's
mm.
why we all try to speak English here. So you feel
Yeah, yeah,
confident and comfortable the whole process.
absolutely. There's some things that even if you can speak relatively good Spanish, that as an English person, there's some words that you're not going to know, and there's some
Yeah.
sentences that you're not going to be able to express
Yeah,
yourself
it is very
really well.
important that you understand the whole process.
Hmm. Yeah, yeah, definitely. So, yeah, yeah. I
So
mean, I
thank you,
definitely recommend.
thank you very much, Andrew. I think you have answered all the questions I had to ask you, and you gave me a very complete explanation of your experience here with us. Thank you very much for your help
Oh,
and
you're
for
very
your time.
welcome. Yeah, you're welcome. I'm sure that everybody who watches me on my YouTube channel will be. I've had so many comments already about it, and from people in Computer on the streets, people that I know, and it's given me more confidence to talk to people because you wouldn't think it, but I was a really shy child, and yeah, yeah, I know. Yeah, you would not
Can't
think it,
imagine.
but no, I really what I was socially, I was ridiculous as a child. I just could not talk to people, and it even came down. I've been trying a lot of times in my life to recover from that. I even got a job. I didn't like answering the telephone to people either. I was that nervous. But when I was about 30, I got a job in a call center deliberately so that phone calls were coming at me all of the time, so that I could learn to speak to people more confidently. But this has made an awful lot of difference. I can speak to people with a lot more confidence now, knowing that I don't have to smile like this anymore. And
Yeah.
uh, and even though I think they're probably sick about me of me talking about my teeth now, but that's that's okay. I'll change the subject every now and then.
You look great, Andrew. Thank you very much.
Thank you. You're very welcome.